Hello and welcome to Feeding Your Late Preterm Newborn. Feeding is one of the most important parts of caring for your late preterm baby. Because babies born a few weeks early are still developing important feeding skills, they often need extra support and monitoring to ensure they are eating enough and growing well. In this video, we'll discuss feeding cues, feeding frequency, signs of successful feeding, and when to ask for help. Feeding does much more than satisfy hunger. Good nutrition supports your baby's growth, brain development, temperature regulation, blood sugar stability, and helps remove bilirubin from the body to reduce jaundice. Because late preterm babies may tire easily, feeding can sometimes require extra patience and attention. Late preterm babies are often still developing the coordination needed to suck, swallow, and breathe effectively during feedings. Because of this, they may fall asleep during feedings, feed more slowly, have a weaker suck, or require more encouragement to complete a feeding. These challenges are common and do not mean your baby is unhealthy. However, they do mean that feeding should be monitored carefully during the first days and weeks of life. Learning to recognize early hunger cues can help feeding sessions go more smoothly. Early signs of hunger include stirring, stretching, bringing hands toward the mouth, rooting, and lip smacking. Crying is often a late sign of hunger. Whenever possible, try to begin feeding before your baby becomes very upset. Most late preterm babies should feed every 2 to 3 hours. This means your baby should feed at least 8 to 12 times every 24 hours. If your baby does not wake on their own, you may need to wake them for feedings. Your healthcare team will let you know if a different feeding schedule is needed for your baby. If you're breastfeeding, remember that both you and your baby are learning together. Many late preterm babies breastfeed successfully, but they may need additional time and support while developing feeding skills. Skin to skin contact can help regulate your baby's body temperature, encourage feeding cues, and support milk production. Listen for swallowing and watch for rhythmic sucking during feeds. Some babies may receive express breast milk, formula, or a combination of both. Your healthcare team is here to support you in making the feeding decision that is best for you and your baby. When bottle feeding, hold your baby in a semi upright position and allow breaks as needed. Watch your baby's cues and avoid forcing them to finish a feeding. Signs that feeding is going well include hearing swallowing during feedings, your baby appearing content after feeding, increasing wet and dirty diapers, and healthy weight gain. Your healthcare team will provide guidance on what diaper output is expected for your baby. Generally, at minimum, we expect your baby to have one wet diaper for every day they are old until they're 7 days old. So, one wet diaper day one, two wet diapers day two, and so on. Once your baby is 7 days old, you would want to see 7 to 10 wet diapers per day. One dirty diaper per day is generally sufficient, but you will likely see more than that, and that's okay. Because late preterm babies often become sleepy during feedings, you may need to gently encourage them to stay awake. Some simple techniques can often help improve feeding sessions, including skin to skin contact, diaper change before feeding, gently rub feet or back, unswaddle baby, and talk softly to your baby. It is important to contact your healthcare provider if your baby misses multiple feedings, is difficult to wake, feeds poorly, has fewer wet diapers than expected, or if you have concerns about dehydration. Dehydration can develop quickly in newborns. If you notice any of the following signs, please contact your healthcare provider promptly: dry mouth, few wet diapers, extreme sleepiness, and poor feeding. After discharge, follow up appointments are important to monitor weight gain, feeding progress, and overall health. Be sure to attend all scheduled appointments and discuss any feeding concerns with your baby's healthcare provider. Remember, many late preterm babies need time to develop strong feeding skills. With patience, support, and frequent feeding, most babies continue to improve and grow well. Before we finish, let's review some of the most important things we've learned. These questions can help you think about what you've learned and help us know if we've explained things clearly. In your own words, how often should your baby eat? Most late preterm babies should feed every 2 to 3 hours, or about 8 to 12 times in 24 hours. What are some signs that your baby may be ready to eat? Early feeding cues include stirring, stretching, bringing hands to the mouth, rooting, and lip smacking. What are some signs that your baby is feeding effectively? Signs that feeding is going well include hearing swallowing during feedings, your baby appearing satisfied afterward, having increasing wet and dirty diapers, and gaining weight appropriately. Late preterm babies often become sleepy during feedings. What are some things you can do to help keep your baby awake? These simple techniques can often help your baby stay awake and feed more effectively. Skin to skin contact, change diaper before feeding, gently rub feet or back, unswaddle baby, and talk softly to your baby. When should you contact your healthcare provider about feeding concerns? Contact your healthcare provider if your baby misses multiple feedings, is difficult to wake, has fewer wet diapers than expected, or if you have concerns about how your baby is feeding. What are some things you can do to support your baby's feeding success? These simple steps can make a big difference in helping your baby grow and thrive. Feed every 2 to 3 hours, watch for feeding cues, track wet and dirty diapers, practice skin to skin contact, and ask questions when you need help. Remember, feeding a late preterm baby can take time and patience. Many babies need extra support while developing strong feeding skills. You do not need to remember everything perfectly. Your healthcare team is here to answer questions and support you every step of the way. Every feeding is an opportunity to nourish your baby, support healthy growth, and build confidence as a parent. You know your baby best. If something doesn't seem right, trust your instincts and reach out for help. Thank you for taking the time to learn about feeding your late preterm newborn. In our next video, we'll discuss jaundice, what causes it, how it's treated, and what signs to watch for after discharge. Remember, your healthcare team is here to support you and your baby every step of the way.